have drug prices coming down 500, 600, 700% because of me.
And you wanted
In other words, we're going to have the lowest drug prices, tied for the lowest drug prices anywhere in the world. It's called favored nations, and you don't talk about it. It's probably the biggest thing to happen in medicine in the last 100 years.
President Trump earlier today discussing his new lower Medicare prices for 15 drugs. That includes the weight loss drug Ozempic. The White House says that reduced drug prices will actually save taxpayers $12 billion. And as you just heard, President Trump calls the price reduction the biggest thing to happen to medicine in the last 100 years. This comes as healthcare remains top of mind for millions of Americans, as costs could drastically change for those receiving coverage through the Affordable Care Act. Since enhanced premium subsidies, also known as discounts, they're set to expire at the end of this year. And that could cost the estimated 22 million Americans receiving those benefits a lot. To put it all into perspective, ACA Marketplace enrollees with premium payments at nearly $900 in 2025 can expect to pay more than double that, hovering just over $1,900 in 2026. And those aren't the only shocking numbers. When you take a look at this new data, which reveals total annual U.S. spending reached $4.9 trillion, averaging nearly $15,000 per person, $25,000 per family, with Americans paying $1,500 out of pocket. As the December 15th deadline to sign up for 2026 coverage nears, lawmakers remain divided, with the president himself now saying some kind of extension may be necessary. Take a look.
I'd rather not extend them at all. And maybe some kind of an extension may be necessary to get something else done, because the Unaffordable Care Act has been a disaster.
But this statement is causing some backlash within the party, as reports now say top House Republicans, that includes House Speaker Mike Johnson, have little interest in actually extending these expiring ACA subsidies. So what's going to happen next? To help answer that big question, we bring in the host of Batya right here on News Nation. That's Batya, Ungar-Sargon. Batya, thanks so much for joining me on this Sunday evening.
Thank you so much for having me. What a pleasure to be here with you.
You bet. It's good to see you. Let's start with those ACA subsidies expiring at the end of the year. I just laid it all out. That could mean skyrocketing costs for millions of Americans. President Trump, Batya, saying this week that he's open to the extension, even as a bridge to a more permanent fix. But we are seeing House Speaker Mike Johnson reportedly telling the White House that most Republicans have little to no interest in actually extending those subsidies. So ultimately, who do you think here is calling the shots? Obviously, we have the president, the commander-in-chief, who's saying one thing, but then a very other powerful Republican, House Speaker Mike Johnson, saying the other.
Yeah, I mean, I think Mike Johnson's going to do what Donald Trump tells him to do at the end of the day. I don't think President Trump wants to go into the midterms and the entire election cycle with, $1,000 increase on health care hanging around his neck for, middle-class families. What I thought was so funny was when he said, we're lowering the cost of drugs. True. This is something every Democrat promised to do and didn't pull off, and Donald Trump pulled it off. But then he says to the media, you never talk about it, which is true, but he also never talks about it. This is an enormous, enormous achievement of this president. I really don't know another politician who could have pulled it off, and yet he seems very uninterested in discussing it. If I were him, what I would do on healthcare is I would do what he's doing with Walmart and Target and all these other big corporations. Every time they threaten to raise prices and he picks up the phone and basically tells them, don't you dare. I think there needs to be a cap on premium increases for any insurance company that gets funding from the government. It is so simple and so obvious. So I'm really hoping that they sort of pick up on that.
Yeah, it seems as if the solution is right there in front of us and possibly so easy to achieve. But obviously, we know that this is a very complex industry. It has so many different layers. And I want to actually get into those layers because obviously at the very core of it, we have the payers themselves, the Americans out there who are enrollees, who are now all of a sudden seeing these skyrocketing costs, potentially, especially if these subsidies don't get renewed after they expire. But also, we're also looking at the insurance companies, the doctors. Who really is to blame when we're seeing these rising costs year over year? I mean, look at the chart that's right here in front of us. From 1960 to 2023, that line just continues to go up and up.
Yeah, I think that when you drill deeper into the data, it's not even like doctors are making more money. A lot of that is going to administrative costs. If you look at hospitals, for example, the largest increase is in administration and administrative costs. The insurance companies are obviously raking in trillions and trillions of dollars. It's utterly appalling and despicable. We're the richest country on earth, and yet the quality of the care is just so appalling. When I was interviewing working class Americans for my book, Second Class, this was one of the top issues that people brought up, whether they were Democrats or Republicans. They sounded exactly the same. They wanted much more access to high quality, affordable health care. And there's something just so totally despicable about the fact that our healthcare costs just keep going up and up and up and up. And yet the quality is not increasing at all.
Yeah, I'm so glad that you brought that up because this isn't a partisan issue. I think every American out there wants to be able to take care of themselves and their family at an affordable rate. Now, whether that involves Obamacare or not, that's a completely separate discussion. But overall, we are seeing these skyrocketing rates when it comes to health care. But it's not just that. As we continue to talk about, affordability is going to be the #1 issue that's driving the midterms next year. So I wonder now, bringing it back to partisanship, if we don't find a solution, whether or not this will really cost the Republicans next year, because after all, they are the ones in charge.
Trump is very pragmatic, and I think what's probably going to happen is they will have some sort of extension here. There's something about it that just feels not just like awful from a public policy point of view, but there's something that feels sort of morally repugnant about throwing good money after bad, because of course the money that gets funneled through the ACA in terms of these subsidies just goes straight into these rapacious insurance companies' pockets. It doesn't actually go towards making middle-class Americans have more access to healthcare. But I think at the end of the day, the political question, which Trump is always extremely savvy about, will outweigh that one, and I think we will see some sort of extension of those subsidies.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.